Hey guys, in this video we are going to cover flowcharts and diagrams from the topic of aortic regurgitation. So starting with table 1, the major causes of aortic regurgitation. So AR could be because of damage in the valve or it could be because of damage in the surrounding root. The valvular causes includes congenital cause like the bicuspid aortic valve, endocarditis or rheumatic fever, myxomatous degeneration leading to prolapse, radiation, trauma, infection like syphilis or ankylosing spondylitis. This could be asked in the examination, or it could be because of aortic root diseases like aortic dissection, medial degeneration, Marfan syndrome, bicuspid aortic valve, non-syndromic familial aneurysm, aortitis because of infective or autoimmune cause, or commonly hypertension. Now coming to staging of AR. So all the valvular diseases, the staging is same. Stage A refers to at risk of developing the disease, like patient having bicuspid aortic valve or patient having aortic sclerosis. That is described as stage A. Stage B refers to progressive, mild or moderate diseases of aortic regurgitation. Stage C is severe aortic regurgitation, but here the patient is asymptomatic. That is the key term. And stage D is known as severe aortic regurgitation, but here the patient is symptomatic. And the other thing is stage C in AR has been divided into two. One is C1, one is C2. In stage C1, the ejection fraction is more than 55% and the left ventricular end systolic diameter is less than 50 mm. Whereas in stage C2, the ejection fraction is less than 55% and LVESD is more than or equal to 50 mm. Now you should only remember the staging of severe aortic regurgitation. So in severe aortic regurgitation, the regurgitant fraction is 50 percentage and the volume which has been ejected back into the left ventricle should be equal to or more than 60 ml, and the effective regurgitant orifice area from which the regurgitant jet is passing to the left ventricle, it should be more than or equal to zero point 0.3 centimeter square. So these three things you should remember. Now coming to the management slide. So first of all, you should know whether the patient is symptomatic or asymptomatic. If the patient is symptomatic and patient is having severe aortic regurgitation, then the patient has been classified into stage D. And obviously, if the patient is symptomatic, you have to go for surgery. Okay. Now, next thing is patient in stage B or stage C? If the stage B is there and the patient is undergoing any other cardiac surgery, or in C stage also, if patient is undergoing any of the cardiac surgery, then you need to go for aortic valve replacement. Okay, aortic valve replacement. And apart from that, in stage C, if the patient is having stage C1 or C2, then also you have to go for cardiac surgery. Okay. And apart from that, only other thing is, if on the serial monitoring, if the patient is having ejection fraction less than 55%, that is patient is developing stage C2 based on your more than equal to 3 study, then also, and the patient is at low surgical risk, then also you will go for aortic valve reconstruction in this patient, replacement in this patient. That's it.